Today, our talk is titled APOL1-Mediated Kidney Disease and Autoimmune Conditions. And we're very excited to have our speaker, Dr. Gisele Vajgel.
Thanks so much, Dr. Waguespack, for your nice introduction. And firstly, I would like to thank Dr. APOL1 for this kind invitation to have me here as a speaker amongst top nephrologists. I saw that Dr. Glassock is here, so I'm very honored to be among you. Glaucoma is an outstanding educational platform, and I usually recommend it to my fellows and colleagues. So it's a great honor to be here. We are in an international platform, so it should be good to show you the Brazil map. And I'm based in Recife, which is a city in the northeastern Brazil by the coast. This is my hospital. This is the University Hospital from Pernambuco. Pernambuco is a state with around 10 million people. We have a population that's the same size of Portugal, for example. So yes, as you can imagine, Brazil is a huge country. It's a continental country with more than 200 million people, with a very high admixture population. So it's very interesting to study APOL1-mediated kidney diseases in such conditions. Those are my disclosures in general. And for this particular talk, I have a disclosure that I participate as a principal investigator for a clinical trial sponsored by Vertex. And hopefully this agenda could be interesting for you all, and I can keep you on for the next hour. We are going to cover epidemiology and physiopathology of APOL1-mediated kidney diseases. We are going to talk about the immune pathways associated with APOL1 kidney diseases. I'm going to outline the outcomes of lupus nephritis, GN in general, kidney transplantation associated with the risk genotypes, and finally, briefly, I'm going to talk about future perspectives for treatment. Firstly, I'd like to show you this data from the American Center for Disease Control. It's known that everybody knows that CKD is more prevalent among those over 65 years old, women, and non-Hispanic Black people, even when adjusted for risk factors. So Afro-Americans have 3 to 4 times more advanced kidney diseases than white Americans, even though they are only 13% of population. So in 2008, we believed that the gene responsible for that disparity was the MyH9. However, in 2010, it was found that the MyH9 was actually in a linkage disequilibrium with APOL1 gene, which is located in the chromosome 22. APOL1 codifies this protein called apolipoprotein L1, and it was responsible for the disparity seen in CKD in patients with African ancestry. The wild type allele was called G0, and the risk alleles G1 and G2. In G1, there are 2 amino acid substitutions that almost always occur together, and the G2 has these 2 amino acid deletions. So having 2 of those risk alleles, which is considered the classical risk genotype, is present in 13% of Afro-American population. 10,000 years ago, individuals with the variants had a survival advantage because the presence of at least one of those alleles protected the person against this infection caused by Trypanosoma rhodesiensis. And however, having those 2 risk alleles confers a higher risk for CKD. CKD was not important 10,000 years ago, but people at that time did not live enough to have CKD, but nowadays it's more important for us. So the protein apolipoprotein L1, the wild type, is produced by the liver and circulates attached to HDL cholesterol. And when it enters in the parasite, it promotes lysosomal swelling and lyses the parasite. So the Trypanosoma brucei rhodesiensis produced a protein called serum-resistant associated protein that blocks the APOL1 and saves the trypanosoma from dying, and so the parasite can infect the human. The protein produced by the risk variants G1 and G2 is not able to be inactivated by this serum-resistance associated protein, so the trypanosoma dies, which was a survival benefit for that time when people died from those diseases, serum sickness disease. It seems that the population of Americas came through waves of migration from the Bering Strait and currents from Asia and Polynesia as well.